Good morning. My name is Taylor. I'm going to be your nurse for today. I just wanted to come in and introduce myself and ask if it was okay with you that I do a little quick assessment. This just gives me the chance to kind of see what's going on with you and make sure that everything looks and sounds okay. Is that all right with you? It is? Okay, perfect. Let me go ahead and sanitize my hands. All right, can you tell me your name and date of birth? Happy Koala 5692, thank you. Do you have any allergies I should know about? No allergies? Perfect. Can you tell me what year it is? It is 2020. And do you know the current president? It is Donald Trump. Okay, well I'm just going to have you sit up straight for me. What I'm just going to kind of shine my little pen light into your eye. And I'm just checking for your pupillary responses, okay, Miss Koala? Awesome. Perfect. I'm going to do the other side. Awesome, thank you. Now if you could, stare at the wall behind me and then refocus here on my pen light. Perfect, accommodation looks good. Thank you very much, Miss Koala. I'm going to remove your linens just a little bit, if that's okay with you. And I'm just going to assess the skin for any scarring or abnormalities. Looks like Miss Koala has a little scar on her lower right groin area. I'm going to check for your skin turgor here at the clavicle. Awesome, perfect. Thank you, Miss Koala. Well, now I'm going to go ahead and move to your breath sounds, your lung sounds, and then I'll listen to your heart right after, okay? So we do 4 breath sounds on the anterior. And then I'm going to go ahead and do my one lateral side sound on each side. Thank you, Miss Koala. Now I'm going to move posteriorly, where I'm listening to 6 sounds, alternating between the left and the right lung so that I can compare the sounds to each side. Perfect. Thank you so much, Miss Koala. Now I'm going to go ahead and move to your heart sounds, listening with for the aortic, the pulmonic, the tricuspid, and the mitral. Awesome. Thank you very much, Miss Koala. Now I'm just going to go ahead and take a look at your arms real quick, just kind of assessing for any edema. And I'm going to check your radial pulses, as well as capillary refill. Okay, thank you so much. Now I'm going to ask you to go ahead and lie back and be comfortable. I'm going to inspect your abdomen and kind of listen to your belly a little bit, okay? Awesome, I'm just going to move your arms to the side. Again, belly looks good, except for that scarring on her lower right groin area. So now I'm going to listen to your belly sounds in 4 quadrants. Perfect. Thank you, Miss Koala. And now I'm going to kind of just touch on your belly a little bit. You might feel a little pressure, but if you have any tenderness or pain or uncomfortability, please let me know, okay? So I'm palpating in all 4 quadrants as well. Perfect, thank you so much, Miss Koala. Now I'm going to move to the lower extremities. Again, checking the skin, make sure everything looks good. Checking for edema. I have our posterior tibial pulses, dorsalis pedis pulses, and also checking the feet for capillary refill. Okay, perfect, Miss Koala. Have you sit up. I'm going to cover you back up with your linens. Is there anything else I can do for you while I'm in here? No? Okay, perfect. Well, I'm going to go ahead and just check on some other patients, and then I'll get your medications ready for this morning, and I'll be back in to give you those, okay? Perfect. Thank you so much, Miss Koala.